Good morning and welcome to our weekly briefing. As usual, we'll start off with an update to the numbers. First, since last week, 890 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 170 new cases per day. Following the trend from the last week, our case numbers continue to drop. This is still a really long way since the summer when we were seeing about 25 cases per day, but much better than 2 weeks ago when we were at about 270 new cases per day. We're still seeing more than 7,000 tests per day, and our percent positive rate is about 2%. 5,000 Philadelphians got their first dose of COVID vaccine since last week, and more than 3,000 became fully vaccinated. And the number of people getting booster doses continues to rise. Last week, I reported that we gave out a record 10,000 booster shots, but this week we've given out 13,000 boosters. That means that in total, more than 55,000 Philadelphians have received their booster. Overall, 87.6% of adults and 81.2% of those 12 and over have had at least one shot. 71.5% of adults and 66.3% of those 12 and over are now fully vaccinated. So the big news this week is that the CDC recommended last night that children between 5 and 11 are now eligible to be vaccinated. This recommendation is for a special formulation of the Pfizer vaccine. The children won't be getting the same dose as teens and adults. They'll be getting a smaller dose using special smaller needles. This recommendation was made after the company ran clinical trials with thousands of children. What they found was that the vaccine was safe and effective. Side effects were considered mild and generally resolved within a day or two. The vaccine was found to protect children from being diagnosed with COVID. The FDA and their independent experts reviewed the data from these trials and gave emergency use authorization. And then yesterday, the CDC and their independent experts reviewed the data again and the FDA's authorization, and they recommended that every child between 5 and 11 be vaccinated against COVID. So we've ordered more than 20,000 doses of the pediatric vaccine in our first order, and we expect to order plenty more as we're able. It's coming in slowly though, and in many cases being shipped directly to vaccine providers. We've told our providers that as soon as they get enough vaccine, they should begin vaccinating children. We've heard that some counties are waiting until they have vaccine in all of their clinics, but we don't want to wait. So we're instructing our partner clinics that they can begin vaccinating as soon as they have the ability to, now that it's been approved. So here are the places that it will be available. Children can be vaccinated against COVID at any city-run community clinic, most pharmacies, health centers, and at many pediatricians' offices. Some pediatricians have said they'll call patients to come in when a dose is ready for them. We're working to make sure that phila.gov/vaccine and vaccines.gov are up to date with the latest information. We know that for the first few days, it may be frustrating to find pediatric vaccine. I wish that wasn't just the way it is right now, but we can't control where the vaccine ships or how quickly it ships. And we do want to start vaccinating kids as soon as possible. So this is a big step back toward normal, and I'm very excited to see it happen. We're working hard to make sure it's available in as many places as possible, as soon as possible. We will be updating our website at phila.gov/vaccine with locations and times that kids can be vaccinated. One thing that I'm excited about is that getting children vaccinated will help make the winter holidays like Christmas and Hanukkah as safe as possible for everyone. But Thanksgiving will be here before the kids are fully vaccinated, so we have to continue our due diligence. This means common sense safety measures, like masking and limiting indoor parties. But I think we all remember how difficult it was to get tested before Thanksgiving last year. We anticipate that many people may want to get a test before they go to Thanksgiving dinner, especially if they'll be seeing someone elderly or immunosuppressed, and particularly if there are unvaccinated family members. So everyone needs to think ahead about how this is going to work. If you try to go to a testing site the day before Thanksgiving, it's likely that you'll have to wait a long time and you might not be able to get a test. One way to plan ahead would be to use at-home COVID testing. Buying rapid at-home tests now to use for Thanksgiving will ensure that you can be tested before sitting down with your vulnerable grandparents. It's important to remember, though, that a negative test is only for that particular moment in time. The longer between the test and the gathering, the more likely that you could actually be contagious, especially if you're not vaccinated. So to wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. And now I'll turn it over to Zelly to present these remarks in Spanish.
Buenos días y bienvenidos a nuestra sesión informativa semanal. Como de costumbre, comenzaremos con una actualización de los números. Primero, desde la semana pasada, 890 habitantes más de Filadelfia han sido diagnosticados con COVID. Hasta ayer, estamos viendo un promedio de 170 nuevos casos por día. Siguiendo la tendencia de la semana pasada, nuestro número de casos continúa disminuyendo. Esto todavía es un largo camino desde este verano, cuando estábamos viendo 25 casos por día, pero es mucho mejor que hace 2 semanas, cuando estábamos casi en 270 nuevos casos por día. Todavía estamos viendo más de 7,000 pruebas por día y nuestra tasa de porcentaje de positivos sigue siendo alrededor del 2%. 500,000 habitantes de Filadelfia recibieron su primera dosis desde la semana pasada y más de 3,000 se vacunaron por completo. Y el número de personas que reciben dosis de refuerzo continúa aumentando. La semana pasada informé que entregamos un récord de 10,000 inyecciones de refuerzo. Para esta semana hemos entregado 13,000 refuerzos. Eso significa que más de 55,000 habitantes de Filadelfia han recibido su refuerzo. En general, el 87.6% de los adultos y el 81.2% de los mayores de 12 años han recibido al menos una inyección. El 71.5% de los adultos y el 66.3% de los mayores de 12 años están completamente vacunados. La gran noticia de esta semana es que la CDC recomendó anoche que los niños entre 5 y 11 ahora son elegibles para ser vacunados. Esta recomendación es para una formulación especial de la vacuna de Pfizer. Los niños que no reciben la misma dosis de los adolescentes y los adultos recibirán una dosis más pequeña, con agujas especialmente y más pequeñas. Esta recomendación se hizo después de que la compañía realizara ensayos clínicos con miles de niños. Lo que encontraron fue que la vacuna era segura y efectiva. Los efectos secundarios se consideraron leves y generalmente se resolvieron en 1 o 2 días. Se descubrió que la vacuna protege a los niños de ser diagnosticados con COVID. La FDA y sus expertos independientes revisaron los datos de los ensayos y dieron autorización de uso de emergencia. Luego ayer, la CDC y sus expertos independientes revisaron los datos nuevamente y la autorización de la FDA y recomendaron que todos los niños entre 5 y 11 se vacunen contra COVID. Hemos pedido más de 20,000 dosis de las dosis de pediatras en nuestro primer pedido y esperamos pedir mucho más a medida que podamos. Sin embargo, está llegando lentamente y en muchos casos se envía directamente a los proveedores de las vacunas. Les hemos dicho a nuestros proveedores que tan pronto como reciban suficiente vacuna, deben comenzar a vacunar a los niños. Hemos escuchado que algunos condados están esperando hasta que tengan la vacuna en todas las clínicas, pero no queremos esperar. Estamos instruyendo a nuestras clínicas asociadas para que puedan comenzar la vacuna tan pronto como tengan la capacidad de hacerlo, ahora que ha sido aprobado. Entonces, aquí están los lugares en los que estará disponible. Los niños pueden ser vacunados contra el COVID en una clínica comunitaria de la salud, la mayoría de las farmacias, centros de salud y muchos consultorios de pediatras. Algunos pediatras han dicho que llamaran a los pacientes para que vengan cuando una dosis esté lista para ellos. Estamos trabajando para asegurarnos de que phila.gov/vaccine y vaccines.gov estén al día con la información más reciente. Sabemos que durante los primeros días puede ser frustrante encontrar una vacuna pediátrica y desearía que no tuviera que ser así. No podemos controlar dónde se envía la vacuna ni qué tan rápido se envía y queremos comenzar a vacunar a los niños lo antes posible. Esto es un gran paso atrás hacia la normalidad y estoy muy emocionada de verlo suceder. Estamos trabajando duro para asegurarnos de que esté disponible en tantos lugares como sea posible lo antes posible. Actualizaremos nuestro sitio de web en phila.gov/vaccine con los lugares y horarios en que los niños pueden ser vacunados. Una cosa que me entusiasma es que los niños vacunados ayudarán a que las vacaciones de invierno como Navidad y Hanukkah sean las más seguras posible para todos. Pero el Día de Acción de Gracias está aquí antes que los niños estén completamente vacunados, por lo que tenemos que continuar con nuestra debida diligencia. Esto significa medidas de seguridad, de sentido común, como enmascararse y limitar las fiestas en interiores. Pero creo que todos recordamos lo difícil que fue hacerse la prueba antes del Día de Acción de Gracias del año pasado. Anticipemos que muchas personas pueden querer hacerse una prueba antes de ir a la cena de Acción de Gracias, especialmente si van a ver a alguien anciano o inmunodeprimido y particularmente si hay familiares no vacunados. Todo el mundo tiene que pensar con anticipación sobre cómo funcionará esto. Si intenta ir a un sitio de prueba el día antes de Acción de Gracias, es probable que tenga que esperar mucho tiempo y es posible que ni siquiera encuentre una prueba. Una forma de planificar con anticipación serían las pruebas de COVID en el hogar. Comprar pruebas rápidas en el hogar ahora para usar en el Día de Acción de Gracias asegurará que puede hacerse la prueba antes de sentarse con sus abuelos vulnerables. Sin embargo, es importante recordar que una prueba negativa es solo para ese momento en particular en el tiempo. Cuanto más tiempo haya entre la prueba y la reunión, más probable es que realmente pueda ser contagioso, especialmente si no está vacunado. Para concluir, si desea obtener más información sobre la pandemia y la respuesta de la ciudad, puede visitar nuestro sitio web en phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Muchas gracias. Thank you.
Thank you very much, Sally. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function, and we'll take those questions in the order received. As usual, we ask that members of the press keep their questions focused on the COVID-19 pandemic and the city's response to it. If there are any reporters who do not get the opportunity to ask questions, please follow up with us by email and we will get you an answer. First up, we'll go to Brian Sheehan at Channel 10. Go ahead, Brian. You should be able to unmute.
Yes, good morning. Sorry, I joined a little late, so I'm not sure if this was addressed. But the city has talked about protecting those who are the reason why we have these restrictions in place are to protect those who are unvaccinated. So now with children being able to get vaccinated, does the city see loosening restrictions, and what will it take to get to loosen those restrictions?
So we're not immediately loosening restrictions based on the approval of vaccines for children. We're looking at our vaccination rate, we're looking at case counts and hospitalizations. And, so it's going to take some time. As vaccination rates go up and case rates come down, that calculus starts to change, but we are not yet there. If you look, we're still in pretty substantial transmission.
And I don't know, can you still hear me? And
Yes.
does it take a certain, is there a percentage right now, or is there any way you can elaborate on that any further on what it would take to get to that?
So we haven't come up with exact criteria. It's something that we're very actively discussing internally. The CDC has given a kind of nice rubric of low, moderate, substantial, and high transmission. Philadelphia is on the cusp of moving from substantial into moderate, but nowhere near low. The surrounding counties are still substantially higher. So, we'll probably use that as part of our rubric, along with looking at our hospitals. One of the reasons that I am not giving you this date or this number answer is that if you look around the country, not just at the surrounding counties, but look, for example, at what's happening in Colorado. Their vaccination rates are relatively high. Their hospitals are overflowing and their ICUs are overflowing, primarily with people who remain unvaccinated. So, I think it's important to realize that as long as we have pockets of unvaccinated people, that can still happen. And we're trying to reach those pockets as quickly as we can.
Anything else, Brian?
Nope, that's it. Thank you so much.
Thank you. Next up, we're going to go to Sarah Gantz from the Inquirer. Go ahead, Sarah. Should be able to unmute now.
Hi, good morning. Thanks for making yourself available today. I wanted to talk a little bit more about getting the vaccine to this younger age set. We've been hearing from some providers that they are concerned that healthcare staff shortages will affect their ability to just have enough people to give the vaccine. I'm curious if this is something that the health department is anticipating, and if so, how you're planning on handling that.
So Philadelphia now has hundreds of vaccination sites. And we are not hearing from partners that they will not be able to administer this vaccine. But I will say, if people have trouble in one location, they should absolutely reach out to another location. We are all going to need a little patience. This was just approved last night. And I know that there are parents who would really like their kids to get vaccinated today and may struggle to find places to do that today as the vaccine is being shipped out. But over the next few days, it's going to become widely available. So that people should not have any trouble getting the vaccine, certainly by early next week.
Okay. Just one follow-up question to that. I know a lot of pharmacies are going to be offering it, as you mentioned. Just looking online at the CVS website, for example, right now, if you search for a downtown Philadelphia zip code, there are only maybe 1 or 2 pharmacies that come up that are offering it, that have appointments. Well, they don't even have appointments, but a couple pharmacies come up as having the vaccine for the next couple of weeks. And I guess what I'm curious is if this is the issue that you're describing, that it just hasn't gotten there yet, or are you expecting that the number of pharmacies that offer it will be limited and you just have to make sure you go to a pharmacy that is offering this vaccine?
So my understanding is that there will be lots of pharmacies and other providers who will be offering this, but it was approved last night. People are scrambling this morning because it was a day earlier than some folks were anticipating. The first shipments have definitely arrived, but not necessarily the first shipments to every provider. So that's why I'm saying, if you have trouble today and you really wanted to do it today, give it a day or two. We saw this with boosters too. The first couple days, really, intense. And then very quickly, it became very easy to get. So, hang in there. You will definitely be able to get this for your child.
This is my last one. Sorry to monopolize your time. Is there anything, I know you mentioned that the vaccine for this younger age set is slightly different. It's a smaller dose. It uses smaller needles. Is there anything else unique about the way it's administered that requires different training for medical providers, or would in any other way be different, or is it just a different dose size and needle size?
So we have sent out training materials to our providers. It's the same vaccine, but it because the dose is so small, it actually is diluted differently. Otherwise, it would be too small an amount to draw up accurately. So people can't just draw up a smaller amount of the regular vaccine because getting the dose right would be impossible.
All right, thank you very much.
Thank you very much, Sarah. Next up, we're going to go to David Melander from Philly Sports Blitz. Go ahead, David.
I just have one question. With the weather getting colder out, are there any talks about having masks for outdoor sporting events, like for Eagles games for the rest of the Eagle season?
So we're not talking about increased mask requirements for outdoor sports at this point. My bigger worry with the weather getting colder is that more people will start gathering inside. We've had a nice warm fall, and I think that's helped us with our rates. So just, as people start going inside, just be careful. But outdoors seems to be reasonably safe.
All right, thank you.
All right, thank you very much, David. I'm going to do a last call for questions. If anyone has a question for Dr. Bedigal, looks like we have Ayanna Jones from Philly Tribune. Go ahead, Ayanna. You should be able to unmute now.
Yes, good morning. I appreciate you making time to speak with us today. I just had a quick question around the issue of vaccine hesitancy. While you acknowledge that there may be a wait time for parents that are interested in getting their children vaccinated, and I'm sure that there's a lot of parents that want to do so, there are always those that have questions about the vaccine and are maybe apprehensive about vaccinating their young children. What might be some key messaging, or might be some messages that you want to get out to parents to let them know about the safety of this, and that, because I'm sure there's some concerns.
Yeah, no, thank you for that question. That's a really important point. So yeah, I think there will be some parents who rush right out and a lot of other parents who are not quite sure. And to them, I would say that, I've looked at the data, the FDA and CDC experts have looked at the data. I've spoken with Dr. Stanford, she's looked at the data. Lots of physicians have looked at this and are confident that this vaccine is safe and effective for kids. Although kids do have, in general, a milder form of COVID than adults, we have still seen more than 8,000 kids end up in the hospital with COVID and more than 700 children die from COVID. So we really want to make sure that kids get vaccinated. They also, of course, can carry COVID to older folks who may be more vulnerable. I will also say that every single physician I know is getting their kids vaccinated if they have children who are age eligible, and many of them have been hanging on desperately waiting for this moment. So, if that helps to make people more confident, people who really have been digging into this data deeply want it for their own children as soon as possible. The other thing I'll say is that one of the reasons we really wanted to get as many of our vaccines for children providers, pediatricians, family doctors who take care of people in the office, we wanted to get them up as vaccine providers. That's because for a lot of people, they need someone who will sit with them and answer their questions. They may have very good questions and be ready to move to get their child vaccinated, or at least to seriously consider it, if they can have the time to get those questions answered. And I would encourage anybody who still has doubts to sit down with their pediatrician, with their family doctor, ask your questions. Don't be embarrassed about them, but ask them, because by answering those questions, that's how we're going to get Philadelphia protected.
Thank you.
Thank you very much, Ayanna. This will be the last call for questions. All right. Seeing no other hands raising, I will call the lid on today. Thank you all very much for joining us today. We're going to conclude today's press briefing now, and we will announce the next briefing via media advisory when we have a time and date. Thank you all very much.